Hello, everyone, and welcome to the May Model Aquatic Health Code Network webinar titled Cryptosporidium in Public Swimming Venues, Recommendations for Reducing Crypto Risk in Swimming Pools, with featured speaker Dr. Laura Suppes, Assistant Professor in Environmental Health Program, University of Wisconsin, Eau Claire. Before we begin, I'd like to go over a few logistics. So we'll be using the audio from your computer speakers for this webinar. So if you have dialed in, you do not need to be dialed in, just the speakers are dialed in. And due to the audio being through the computer, we will have question and answers submitted through the chat box that many of you are already utilizing on the right-hand panel of your screen. Feel free to ask questions anytime throughout, and we will field them at the end. And finally, this webinar is being recorded and will be distributed to all participants and posted on the NACCHO MAC Network webpage. So first, I have a couple updates from NACCHO's side of things. So our next MAC webinar will be held in July 2017. This July, we also have a panel session being held at NEHA Annual called Taking a Dive into the Model Aquatic Health Code. It will include a facilitated discussion on various aspects of the MAC. We also like to promote the Model Aquatic Health Code Network webpage that has all of our archived webinars, MAC resources, and if you are interested in joining the MAC network, you can send a request to mahcnet@nacho.org. And again, we'll have questions at the end. So I'll hand it over to Doug Sackett, who will give us some CMAC updates.
On what's going on with the Council for the Model Aquatic Health Code. We're in the midst of our 2017 code change opportunity cycle, and we did receive 180 change requests, and those are all available for review on the cmac.org website. I've listed the web page where you can see them. The Technical Review Committee is in the process of the change request reviews. There's a meeting for the members. You can listen in on those calls. You can't participate, can't voice anything. Let's see. But you can listen in, but you do have to be logged in as a member in order to have access to the schedule, which is posted on the website. You'll see it under the burgundy button on the top right-hand side of our web page under Find 2017 Info On, and there you can access the CR review meeting schedule along with the CRs that are scheduled for particular dates. And again, CMAC members can join the conference, but as listen only. The member comment period for influencing the TRC reviews, meaning if you have additional information, maybe for or against, or that the TRC should be considering, that member comment period is open until May 31st. Again, you do have to be a member to submit comments, and in order to do that, you open up a specific change request, and there will be, at the bottom, you'll see the opportunity for adding a comment. So you may want to do that. Also, what we found is while the members are listening in on the TRC reviews and discussions, that may have triggered something that you may want to comment on. So again, based on that same process, open up a change request, particular change request, and open up a comment form and submit that. And just lastly, note that our online Vote on the Code conference registration, the Vote on the Code conference is in October, but the registration is opened on April 3rd. We've had a number of registrations already. So my contact information is here if you need to get a hold of me either by email or phone, and we do have additional information, a website for the CDC MAC Healthy Swimming or for the CMAC website. And with that, I'm going to turn it over to Michele Hlavsa for her presentation.
Thanks, Doug, and thanks for the opportunity to talk about Healthy and Safe Swimming Week. Healthy and Safe Swimming Week is the week before Memorial Day. This year it's May 22nd to the 28th, and the theme is Diarrhea and Swimming Don't Mix. The objective is to increase awareness of recreational water-associated diarrhea outbreaks and steps healthy swimming stakeholders can take to prevent these outbreaks. Our target audiences are swimmers, parents of young swimmers, aquatic staff, and public health. Again, healthy swimming stakeholders. The call to action for the public is not to swallow the water it swims in and not to swim or let kids swim if sick with diarrhea. For aquatics professionals or the aquatic sector, it's to hyperchlorinate public aquatic venues if they are associated with with an outbreak that's at least suspected to be caused by Cryptosporidium or following a diarrheal incident, also known as a high-risk Cryptosporidium contamination event. The link on this slide takes you to CDC recommendations for fecal incident response for aquatic venues. This April, around mid-April, we released our Healthy and Safe Swimming Week Communications Toolkit. I apologize that it went out a little late this year. I was out on maternity leave. The toolkit includes community outreach suggestions, so how to work with media, how to work with, healthcare providers in your community, and work together to promote healthy and safe swimming in your community. There's also a list of resources or URLs to healthy swimming web content that we think our state and local public health partners might find particularly interesting. There's a sample press release, an op-ed piece. They're written very broadly, so our state and local partners can take them, cut and paste as needed to meet their particular jurisdiction's needs. There's a sample proclamation for Healthy and Safe Swimming Week, as well as a bank for social media messages. The link on this slide takes you to the toolkit page. Healthy and Safe Swimming Week this year was launched with an MMWR report highlighting recent crypto outbreaks linked to aquatic venues, particularly in Alabama, Arizona, and Ohio. And thank you to those state and local partners for working with us on the MMWR. We also highlighted CryptoNet, which is our national tracking system or surveillance system looking at crypto traditional epidemiology data as well as molecular characterization or DNA profiling. We're hoping to get this system going nationally and systematically typing Cryptosporidium specimens so we have a better understanding of what's going on with this parasite in the United States. We also updated CDC's Healthy Swimming website, and the link to that is provided on the slide. And we are this week featured on CDC's main homepage, which we're really excited about because that gets millions of visits each year. On Monday, we hosted a Twitter chat with CBS Health, and we reached 5 million people on Twitter, thanks to participation also with state and local public health partners and aquatics sector partners as well. Today we're doing the MAC network, as you see, and tomorrow we'll be doing a radio media tour talking to radio stations across the U.S. about healthy and safe swimming. We sent out earlier this week or late last week a Gov Delivery announcement about Healthy Swimming Week and its Healthy and Safe Swimming Week and its resources. We also provide MAC updates through Gov Delivery. You can sign up for the Gov Delivery on the Healthy Swimming website. At the bottom, enter your email address. CDC is also promoting healthy swimming through the Did You Know and Have You Heard emails. Did You Know talks about public health issues, CDC communicating to its state and local partners. Have You Heard is state and local partners communicating to sister state and local health partners. This year we're featuring Arizona and the work they're doing to promote healthy and safe swimming. Healthy Swimming promotional materials from CDC are available at the link I provided on this slide as well. It has buttons, badges, posters, brochures, etc. The images on this slide are of posters that we have on our Healthy Swimming website now. These are new for this year. We also syndicate web content on the Healthy Swimming website, so our state and local health partners can take our content and make it look like their own through the syndication process. And when we update on our end, it automatically updates on your end. Finally, we have some printed materials thanks to the generous financial support of the American Chemistry Council. We have a Healthy Swimming brochure available in English and Spanish. You can go to the Healthy Swimming website and order that for free. You can also order 2 pool chemical safety posters for free. They're also available in English and Spanish, and they're laminated to survive in those harsh pool chemical pump room environments. One of the pool chemical safety posters is on safe use, and the other one is on safe storage. And that's it for me. If you have any questions, you can contact Kirsten Yates, our team lead for health promotion and communications, or myself. Thank you.
Great, thank you, Michelle. So now we will move on to our featured presentation. So Dr. Laura Suppes is an assistant professor with the Environmental Public Health Program at the University of Wisconsin-Eau Claire. She received her MPH in Public Health Administration and Policy from the University of Minnesota and PhD in Environmental Health Sciences from the University of Arizona. Her research interests are chemical, biological, and physical hazard identification and remediation in recreational water environments, exposure assessment, and quantitative microbiological risk assessment. Dr. Suppes is a member of the Model Aquatic Health Code Technical Review Committee, National Swimming Pool Foundation Education Committee, and is an NSPF instructor of the Certified Pool Operator course. She is a consultant for the Centers for Disease Control and Prevention and National Environmental Health Association, assisting health departments comparing state and local pool codes to the Model Aquatic Health Code. Her most recent research focuses on assessing human input of pharmaceutical and personal care products in swimming pools and comparing risk of pathogen infection among swimmers in pools with and without hyaluronic acid. So the floor is yours, Laura.
All right, thanks for the introduction, Chelsea, and thank you so much, everyone, for attending. So today I'm going to be talking about some recommendations for reducing Cryptosporidium infection risk at swimming pools, specifically for environmental health practitioners. So I've been reading some of the titles of people logging into this webinar. It looks like we have practitioners from all across the country, and I think even some international people. So that's great. Thanks so much for tuning in. So just a little background on how or why I developed this presentation. So I've been doing some research on swimming pools. That's my area of expertise. But then I also have worked at the local health department level inspecting swimming pools. And so I have a background in inspections and have a little bit of an idea of what environmental health specialists can do just on the ground to try to prevent crypto. So that's sort of what we're going to focus on in the presentation. So the specific objectives of the presentation, first we'll talk about why there is risk of Cryptosporidium infection at swimming pools. Then we'll explore some broad methods for reducing Cryptosporidium infection risk. And then I'm going to discuss the most feasible methods for environmental health specialists to reduce Cryptosporidium risk at swimming pools. We'll start by talking a little bit about why there's a risk of crypto infection and what exactly Cryptosporidium is. So we know it's a parasite or it's a protozoa that causes cryptosporidiosis, which is associated with the symptoms vomiting, diarrhea, nausea, and it can even cause death in immunocompromised populations, which includes children. Also includes the elderly, pregnant women, anybody on immunosuppressant therapies, people with HIV/AIDS, which makes up 20% of the U.S. population. So this is really the population we're concerned about and that we want to try to protect. We know that Cryptosporidium causes the majority of outbreaks in treated recreational water venues, so it caused 50% of the outbreaks between 2011 and 2012. And it's because Cryptosporidium is really ideal for treated recreational water venues for a few reasons. Number one, chlorine is the primary disinfectant or the main disinfectant that's used in swimming pools. And it doesn't work very well at killing Cryptosporidium. So it takes about 20 parts per million chlorine, 12.75 hours to inactivate Cryptosporidium. That's definitely a problem. And swimming is essentially community bathing. So it's like a big bathtub. And if somebody has a Cryptosporidium infection, they have diarrhea in the pool, or even if they just have some of the oocysts on their body, they can get that into the swimming pool and transmit it to somebody else. If somebody accidentally has a fecal release in the water, they can excrete up to 1 billion of these oocysts in one fecal release, and it doesn't take many of these to get somebody else sick. So Cryptosporidium is transmitted through the fecal-oral route, which means that somebody has diarrhea, 1 billion of these oocysts can get into the water, and if somebody swallows just as few as 10 of them, they can get sick too. And if somebody is sick with Cryptosporidium, they can actually excrete it up to 50 days after their diarrhea has stopped. So they might unknowingly be going to different swimming pool venues and contaminating those venues with the oocysts. And unfortunately, there's this perception by swimmers that pool water is sterile. So a lot of swimmers aren't aware that there are these chlorine-resistant pathogens that can be present in swimming pools. So there's this false sense of security that chlorine's killing everything. And so people are more prone to swallow pool water than they would bath water, for example. And then last, swimming pools are recirculated. So if our filters aren't working at maximum efficiency, we could be reintroducing Cryptosporidium into the pool if we're not actually filtering it out of the pool water. So because of all of these reasons, we've seen Cryptosporidium as a problem in treated recreational water venues. So the dark blue bars on this graph are showing the treated recreational water associated outbreaks with Cryptosporidium. And since it emerged in the late 80s, early 90s, we do see that we've seen increased outbreaks associated with this pathogen. And the risk associated with developing an infection of cryptosporidiosis has been quantified, and it's greater in children than adults. So the risk of Cryptosporidium infection in 1 year of swimming pool visits is 29 infections per 1,000 child swimmers and 22 infections per 1,000 adult swimmers. And it's higher, the risk is higher in children because they swallow more pool water and they engage in more boisterous activities that increase that ingestion and thus their risk of infection. So what exactly can we do to reduce the risk of Cryptosporidium infection for our swimmers? Well, we need to start by looking at why these outbreaks are occurring or why infections are spreading. So again, we know that chlorine doesn't really work well at killing Cryptosporidium, so perhaps we can explore some alternative disinfectants. We know that there are some behaviors that swimmers do that increase their risk of infection, so maybe we can try to stop or reduce the introduction of oocysts into water. And then last, we know that pool water is recirculated, so we're not just disposing of the old pool water and putting new water in. We're potentially reintroducing crypto into the water. So we need to perhaps explore some more effective filtration techniques. So I'm going to focus on the use of alternative disinfectants first, and then we'll talk about how to reduce introduction of oocysts, and then last we'll talk about some improving filtration techniques. So the primary disinfectant that's used in swimming pools is chlorine. So we're going to talk a little bit about why chlorine isn't ideal. So the current free chlorine levels that are recommended in the Model Aquatic Health Code and in many local or state swimming pool codes will not inactivate Cryptosporidium in a time frame that reduces swimmer risk. So we know that the contact time of Cryptosporidium is 15,300, which basically means at 1 part per million chlorine, it will take 10 days for Cryptosporidium to be inactivated 3 log. So just for some context, a 3 log reduction is usually what we try to achieve in drinking water treatment. So at 1 part per million chlorine, it's going to take 10 days to kill Cryptosporidium. So that's a common level in swimming pools, and at that level, Cryptosporidium is going to remain in the swimming pool. We do know that the contact time is based on a balance between concentration and time. So if we increase the concentration of chlorine, we can decrease the time to activation. So we do use hyperchlorination as a technique to kill Cryptosporidium after a diarrheal fecal incident has occurred. But hyperchlorination isn't ideal, so there are some issues associated with it. Number one, a lot of chlorine needs to be used, which can be an added expense to a pool facility. So not just because of the chlorine product itself. So obviously if a facility is using more chlorine than needed because there's a diarrheal incident, then they're going to have to purchase that chlorine. But also because of closure time. So if it's a larger water park that relies on admission fees, if there's a diarrheal accident in the morning, that facility is going to need to be closed for the entire day, and they're going to lose out on that revenue. And then that chlorine concentration needs to be maintained at 20 parts per million for the entire 12.75 hours. So I've heard from some pool operators who have gone through the hyperchlorination process, and they've said that the fecal release has occurred in the evening sometime in their large water parks. They've had to get a hotel room at the facility. They've had to set an alarm every hour, wake up, go down to the pool, check the chlorine level, make sure it's at 20 parts per million, and they're being paid overtime at that point. So that can be expensive. There can also be some operator error associated with that. So if there's a less diligent operator who's not checking the chlorine levels frequently, then it might be below 20 parts per million, which isn't going to inactivate Cryptosporidium to a level that we want in that 12.75 hours. Also, operators are having to use test kits that might not test chlorine levels up to 20 parts per million, so they're having to rely on dilution, and maybe some of them don't understand how to do that. We have to know if and when a fecal incident occurred. So if diarrhea does occur in a swimming pool, it obviously dissipates very quickly, and if a lifeguard, pool staff, or a parent doesn't notice that happening, how do we know that we need to respond to that and that we need to hyperchlorinate? So we have to identify the fecal incident first. And then another problem, we know that hyperchlorination doesn't work as well in pools that have high cyanuric acid concentrations. There's a study that was completed recently that explored the effect of cyanuric acid on the inactivation of Cryptosporidium under hyperchlorination conditions. So I'm going to summarize the results of this study in a table. So what the study was looking at was, again, the effect that cyanuric acid has on hyperchlorination. So we know that cyanuric acid is necessary because it prevents photodegradation of chlorine, but if we have too much of it, it can actually prevent chlorine from doing its job. So basically, the study just looked at the effectiveness of chlorine in different cyanuric acid concentrations. So you can see in the first row here, we have chlorine, and across the board in the study, they kept the concentration of chlorine at 20 parts per million. pH also stayed the same at 7.5, and the temperature of the water stayed the same at 77. What did change was the amount of cyanuric acid in the water. So starting in the first column, there was no cyanuric acid in the water, and at 20 parts per million chlorine, it took 8 hours for Cryptosporidium to be inactivated by 3 logs. When just 8 parts per million cyanuric acid was added to the water, it took 20 parts per million chlorine 14 hours to inactivate Cryptosporidium by 3 logs. So from 8 hours to 14 hours with just 8 parts per million cyanuric acid. When cyanuric acid was at 50 parts per million, it took 62 hours for 20 parts per million to inactivate Cryptosporidium. And then at 100 parts per million, which is close to the max limit of 90 parts per million cyanuric acid, it took 20 parts per million chlorine 72 hours. And for the 50 ppm cyanuric acid and 100, you can see that it actually didn't even achieve a 3-log reduction. It was just a 1-log reduction. So cyanuric acid obviously has a really significant impact on chlorine. So this that study led to the new fecal incident response guidelines that were published by the CDC in 2016. So for pools without cyanuric acid, the hyperchlorination response after a fecal release, diarrhea, remain the same, 20 parts per million for 12.75 hours. But in a pool with up to 15 parts per million cyanuric acid, notice that the chlorine still remains at 20 parts per million, but the time is bumped from 12.75 hours to 28 hours. So in a pool that has up to 15 parts per million cyanuric acid, the chlorine has to be maintained at 20 ppm for 28 hours. And then in pools that have greater than 15 parts per million cyanuric acid, they need to be draining their pool and diluting the cyanuric acid down to less than or equal to 15 parts per million cyanuric acid, and then applying their 20 ppm chlorine for 28 hours. So those new hyperchlorination recommendations came out of that study. So again, chlorine is not necessarily ideal since Cryptosporidium is resistant to it, so I wanted to explore some alternative disinfectants. So these are the approved alternative disinfectants to chlorine in the Model Aquatic Health Code, and there are some pros and cons associated with each. So with bromine, the benefit is that it leaves the residual, same as chlorine, in the pool water body, but there actually aren't any published contact time values for Cryptosporidium inactivation, so we don't know how well this kills crypto. UV and ozone, these are both secondary disinfectants because they don't leave a residual in the pool water body, but they are beneficial because they do inactivate crypto very quickly. Copper-silver ions, just like bromine, it leaves a residual, but there aren't any published contact time values for Cryptosporidium inactivation. And then chlorine dioxide, this is potentially a good alternative disinfectant because like UV and ozone, it inactivates Cryptosporidium very quickly, and like bromine and chlorine, it leaves a residual, but it's actually not approved by the EPA just for routine use right now. So it's only allowed for water quality remediation when swimmers are not in the pool because it can produce carcinogens and it can be dangerous to handle. So it has some potential, but still needs some work. Okay, so moving on from talking about alternative disinfectants to talking about stopping the introduction of oocysts. So is stopping the introduction possible? Probably not, but we can try to reduce contamination by controlling sources of the pathogen. So going back to, most of you are environmental health practitioners, so going back to some of your undergraduate environmental health classes, we can rely on the hierarchy of controls to try to choose some controls that are effective, cost-effective, and also that limit the amount of error, human error associated with them. So with the hierarchy of controls, we always want to try to eliminate the hazard first. If that doesn't work, we can try to substitute. If that doesn't work, we can try some administrative controls, then engineering, and then personal protective equipment. So I'm going to suggest some controls to try to reduce contamination of pools with Cryptosporidium, and I'm going to use the hierarchy of controls to try to suggest the best ones. So we'll start by talking about some ways, just general ways to maybe reduce the introduction of oocysts. So going back to our list, we know that Cryptosporidium or treated recreational water venues are ideal for crypto outbreaks because swimming is community bathing. So maybe we can separate children and adults in swimming pools, or maybe we can talk more about and expose the truth that swim diapers really don't work. We know that bathers can excrete up to 1 billion oocysts per fecal release, so perhaps we can try to not allow ill swimmers into the pool, which we're already doing. We can make better swim diapers, or we can try to improve our fecal incidence observation. So if somebody has diarrhea in the pool, you really need to know about it and identify it. And perhaps we can enforce some bathroom breaks so everybody's getting out of the pool and having, if they're swimming with diarrhea, having it in the toilet instead of in the pool. We know crypto has a low infectious dose, so really important to educate swimmers about not swallowing pool water. Parents do a good job of teaching their kids not to swallow bath water, and so they need to understand that a pool is essentially just a large bathtub and they shouldn't be letting their kids swallow pool water either. We know that the oocysts can be released up to 50 days after someone's diarrhea has stopped, so let's not allow previously ill swimmers into the pool. That can be one way to stop introduction. And enforcing Can everyone hear me?
Yeah, we can hear you now.
Okay, sorry about that. So pre-swim showering, even if somebody is sick with Cryptosporidium and they don't have diarrhea in the swimming pool, the oocysts can be on their body and they can introduce them into the swimming pool that way. So showering can get some of that protozoa off of their bodies. And then swimmers perceive pool water is sterile. So we really need to let people know that there is this chlorine-resistant protozoa that exists and that pools aren't necessarily sterile. And although testing pool water with a test kit for chlorine doesn't directly reduce the risk of Cryptosporidium infection, because we know Cryptosporidium can survive for 10 days in 1 part per million chlorine, it gets the word out and makes people aware that swimming pools aren't sterile and that there are hazards associated with them potentially. So again, I mentioned this hierarchy of controls. We want to start with elimination and then move to personal protective equipment as our last control. And so ideally, we want to try to eliminate the hazard from ever occurring. And we already do that. So we try to tell swimmers through signage that they shouldn't swim for 2 weeks after they've had diarrhea. But sometimes swimmers ignore signs. We know that as health inspectors. So perhaps we need to try a new technique. So some techniques that I propose and think might work are group education classes. So for some of these larger groups like swim teams or water aerobics classes at fitness facilities or swim classes, maybe we need to be getting those groups together as a large audience and sitting them down and teaching them about the hazards associated with swimming if you have diarrhea. Or maybe using waivers or contracts as a form of education with these same groups. So having them sign something that says, I will not pee or poop in the pool, makes them aware that they shouldn't engage in those behaviors. So administrative controls, these are primarily associated with education. So we need to come up with some ideas to educate swimmers on why swim diapers don't work. So we can do something like signage, let people know swim diapers are the same as a bathing suit, and also maybe focus on some of these group education classes. So if we're getting these groups together, let them know swim diapers are the same as bathing suits. Get the word out to these groups about the fact that pool water ingestion increases their risk of crypto infection, and also that there are hazards associated with swimming pools. And then educating swimmers on test kit use, either doing this in these group classes or maybe requiring pool facilities to provide test strips, and then requiring pool facilities to provide water chemistry standards so that users can compare their test strip results to the chemistry standards to help them become educated on the fact that pool water is not sterile. And then if we could improve fecal incident observation and make sure that we're actually capturing when people have diarrhea, we can, in these large group education classes, notify parents that you need to tell a lifeguard or pool staff that your kid had diarrhea when they're swimming, because it can be really hazardous to the rest of the swimmers. Or maybe training lifeguards on indicators of diarrheal releases. So I'm not quite sure what these indicators are, but maybe that needs to be researched so we can better train our pool staff and lifeguards to notice diarrhea in the swimming pool. And then enforcing bathroom breaks. So these larger groups at these higher risk pools, like swim teams or open swim, everyone should be getting out of the pool every hour so that they can use the bathroom. And if they are sick, they will be using the bathroom in the right place, not in the swimming pool. And then to enforce pre-swim showering, perhaps you can encourage or require your pool facilities to hire a staff member to check if swimmers are entering the pool area and have wet hair or wet clothing that indicates that they actually did have a pre-swim shower, because that can be really effective at getting some of the pathogens that might be on somebody's body off before they enter the pool. So then we move on to our engineering and our PPE controls. So I guess in this this idea of mine, I'm considering diapers PPE. So I don't know if that's totally appropriate, but that's what I'm doing. So, so an engineering control idea would be to separate children and adults by, in the future, designing pools that are for children or for adults. So we sort of already do this with wading pools, which are primarily used by children. And one of the things that would be good about knowing that only kids are swimming in one pool is that we know kids are usually the ones who are having the diarrheal releases into the swimming pool. So perhaps we can routinely treat those kiddie pools to remove Cryptosporidium on a daily basis in case we miss those diarrheal releases. And then improving swim diapers. So currently there was a study done that showed with Cryptosporidium sized particles that 50 to 97% were released within 5 minutes of swimming after a simulated diarrhea situation. So basically swim diapers are the same as wearing a bathing suit, so maybe somebody can engineer some better ones. Okay, so we also know that swimming pool water is recirculated, so we can either improve current filtration techniques or we can rely on secondary disinfection. So UV and ozone are secondary disinfectants that work really well at inactivating Cryptosporidium. So installing either system is a good way to prevent outbreaks. But for some pools, maybe they can't afford it and they just have a simple sand filter, which is very common. And one way to boost the sand filter's efficiency is to have pool operators apply a coagulant. So polyaluminum chloride coagulants at the appropriate flow rates and also with deep enough sand can be more efficient than just a regular sand filter. So this graph on the right is showing the percent removal of Cryptosporidium in sand filters alone, so just typical sand filters that we see in pools, and then sand filters where a little bit of pre-coat media has been added to the sand filter, so perlite. And in the left 4 bars, basically what that's showing is that sand filters filter at 25% efficiency, and when just a thin layer of pre-coat media is added, their efficiency boosts up to almost 100%. So this is a really potentially good way for your pools that have sand filters to boost the efficiency of their filtration. Or just having new facilities or facilities renovating their filtration to add a pre-coat media filter. So it's an alternative to sand, and this graph is showing the efficacy of different filters that are common in swimming pools. So again, sand about 25%. And then when we get into the pre-coat medias like DE and perlite, we can see that the efficiency of removing Cryptosporidium is much, much higher. So the use of different filters are more or less effective at removing Cryptosporidium. Okay, so we just talked about a lot of ideas to reduce Cryptosporidium infection risk in swimming pools, and some are more feasible than others. So I want to make some suggestions for environmental health specialists. So there's not just one control that can be used. There has to be a combination of different controls. And one that everybody could do tomorrow or before in the next couple of weeks is develop a group education plan. So when I worked at the local health department, we did this very often at restaurants, grocery stores on foodborne illness and food safety. So why not do this at pool venues on pool safety? So either providing education materials, whether it's fact sheets, videos, handouts, to aquatic venues that host these large groups of swimmers and encourage or require organized trainings. So you're requiring the facility, either maybe a community center or a water park or a school pool, to sit down with these groups and provide these handouts, show a video, or show some fact sheets. Or the environmental health specialists themselves could go into the facility, offer to give a training to the swimmers so that they can understand some of the risks associated with swimming pools. So using waivers as a form of education. So environmental health specialists could provide a waiver example to their aquatic facilities, and it could say something like this: by swimming in this pool, you agree not to swim until 2 weeks after diarrhea has stopped. So this helps the swimmer understand that they shouldn't be swimming if they have diarrhea. You agree not to intentionally swallow pool water. This helps them understand they shouldn't be swallowing pool water. You agree not to allow children with diarrhea to swim in bathing suits or swim diapers since neither control diarrheal releases. So this helps parents and others understand that swim diapers don't work. They're the same as a bathing suit, so don't let your kids swim with diarrhea even if they're wearing a swim diaper. You agree not to intentionally pee or poop in the pool water. So we know some people do intentionally pee in the pool water, and we want to stop that behavior. You agree not to splash others in the face. So this is a behavior that has been correlated with increased pool water ingestion. You agree not to enter the pool without showering for at least 60 seconds. So we need swimmers to be showering for at least a minute to get off those excess pathogens. And you agree not to fail to report a diarrheal release into pool water. So this gets the word out that even though it might be embarrassing, people need to be reporting if there was diarrhea in the pool water. So some other things environmental health specialists can do, require pool facilities to provide these test strips, and then also some handouts that help explain what the results of the test strips mean. So this will help swimmers understand that pool waters are not sterile and help them identify some safe or hazardous conditions. Suggest that your pool facilities, especially the high-use facilities, do these mandatory bathroom breaks every hour. So everyone get out of the pool, have somebody coordinate it, have a pool staff designated to monitor the hourly breaks so everyone's getting out and using the restroom. Make sure that your operators understand the new CDC fecal incident response guidelines. So especially for pools with cyanuric acid who are using it, they need to understand the new requirements for remedying or responding to a diarrheal release because they're not going to be effectively inactivating Cryptosporidium otherwise. Require pool facilities to install secondary disinfection. So ozone or UV, very effective at killing Cryptosporidium. But for pools that maybe can't afford that and they just have a simple sand filter, they can be applying a coagulant. So coagulant will bind with Cryptosporidium, make it larger and easier for sand filters to filter out. It is very important that your operators apply the correct dose of the coagulant when they're doing this, because if it's too much or too little, it won't be effective at removing Cryptosporidium or making your sand filter more efficient. For those who are in the position to do so, adopting parts of the Model Aquatic Health Code when updated with recommendations for improving filtration and disinfection techniques to remove Cryptosporidium from pool water. So the Model Aquatic Health Code is a model code, which means it's science-based and it's updated every 2 years with the most recent research from people in academia, industry, and also public health practitioners. So the new ideas really should be adopted by local jurisdictions because it represents the best practices associated with pool operation, maintenance, and safety. So that is all for my presentation. I'm very happy to take questions for anyone who has them.
Great, thank you, Laura. So we were collecting some of the questions as they came in. Some of our folks had been trying to answer them as we were going along. One of the most frequent questions was about the slides. Again, the slides will be posted on NACCHO's MAC network website that you can find through nacho.org. I've also listed the link in the chat box a couple of times, and I can do so again. Let's see. And if you have questions for our speaker, Laura, please feel free to enter them into the chat box. Okay. Great. So let's start off with some of the questions that have not been answered yet. And I think the first one might be from Sarah Snyder. So this would be for Laura or any of our subject matter experts on the line. Do you know if there are any pre-canned trainings already put together for EH to use?
And Sarah, this is Jason Kuntz from CDC's Model Aquatic Health Code on the environmental health side. I'll answer it from a broader perspective first and let the others chime in. Currently, CDC is working with the National Environmental Health Association through a contract to develop Model Aquatic Health Code inspector training. So essentially, it's how to conduct a Model Aquatic Health Code based inspection off the inspection form. We are quite a long way through that training at this point, and we're just starting to enter the clearance process of some of the final content. We hope that that will fill that gap for those wanting to use the Model Aquatic Health Code and have inspectors trained on it. It will be an online training program. If it's related to Cryptosporidium, I'll let the speakers chime in if there's any material related to crypto for training.
This is Michelle. We're happy to share CDC slides on crypto.
Okay, we have quite a few questions coming in here. So due to the large number of attendees on the webinar, which is terrific, so we're going to do our best here to answer these questions as they come in. Let's see. Okay. Okay, something's more just commentary. Oh, wait, I see one right here. My apologies, trying to go through this. From Kara Harvey. I have facilities that want to increase free chlorine to 40 to 50 parts per million to shorten the time required to achieve the desactivation. Are there reasons I can provide that this is not a good idea?
I can answer that. So if you look on the CDC fecal response guidelines for diarrhea, it talks about the different chlorine levels that you can use to inactivate Cryptosporidium. So at 40 parts per million, it just needs to be maintained for 8.5 hours. So since there is that concentration time relationship, it can be manipulated a little bit.
Great, thank you. I think one of the next questions we had on the list was from Kevin Jarancic. Do you think there is sufficient evidence to apply a water treatment toolbox perspective to offer log credit in an aquatic environment?
This is Michelle at CDC, and Jason and Laura, feel free to chime in. CDC's MAC does give credit for UV or ozone in terms of inactivating Cryptosporidium.
Yes, I wouldn't have anything else to add to that. I see one directed for you, Michelle, here. From John. Are particular regions in the U.S. or world associated with higher incidence of crypto outbreaks?
Well, we know we find crypto all over the world. In terms of what we're finding in the U.S., we do see some states reporting more crypto outbreaks than others. We're not sure why that exactly is. We know some of it is because some states have stronger health departments than others. They have different reporting requirements. They have different detection capacities. We also know that just crypto cases in general, not talking about outbreaks, but crypto cases in general are more common in the Midwest than in other states. We think that that could be because of exposure to cattle.
Okay. And thank you, Michelle. And Doug, if you're available, I'd like for you to try to field this question, and I'll add in as well from Madison here. Why is excessive cyanuric acid not a critical violation, one in which causes the pool to close when high levels of cyanuric acid depletes/masks the chlorine content, causing chlorine to be less effective?
Yeah, this is Doug. There is a maximum level in the MAC. I'm not sure, I apologize, but I'm not sure if that is on the list of public health hazards without double checking right now. There will be more coming up on in the MAC in the future on cyanuric acid, how it's looked at. There's an ad hoc committee, and Laura's on that committee too, that's looking at cyanuric acid and with the normal enteric pathogens, normal operating conditions, and it's an incredible work that's being produced by this ad hoc committee, and it will result in a publication, peer-reviewed publication, and what we anticipate is based on that publication, the next steps on how cyanuric acid is being looked at and being dealt with in the code will come from that publication. So don't have any actual anything to offer from that right now, but more to follow when this excellent work is finally published, which we expect to happen this year.
Great, thanks for that. So the next question comes from Gregory. Can you give some examples of coagulants that can be used with sand filters?
So I can field this one. So this work has been ongoing and done by James Ambergy at University of North Carolina, Charlotte. So for any of you who attended the World Aquatic Health Conference, he did a long session all about pool water filtration and talked a little bit about coagulants. And the one that he has researched in his lab is polyaluminum chloride. So I guess I'm not sure specifically what brand names are associated with that, but that's one that he's seen sand filtration increase in efficacy with that coagulant added, with a lower filtration rate, and also with a deeper sand bed.
Thank you. And then thanks, Ellen Meyer, for clarifying CYA not being a critical violation. And I wanted Doug to weigh in on that first, and I was going to respond. So from a cyanuric acid perspective, there are some testing kit limitations too, but you have to look at it from the real risk is in a diarrheal incident that we can define that cyanuric acid plays a level in that. And when the levels get high, you may find yourself in a situation where you have to do significant water replenishment or dumping of the water. What's not as well understood is the impact that cyanuric acid has on the kill time of chlorine-sensitive pathogens. So our experts, like Michelle and Dr. Beach may say it can go from seconds to a few more seconds. So that, I think, is really your main reason for cyanuric acid not being a critical violation, as with no chlorine in the water, there is an immediate health risk. And I may have butchered that a little bit, but that's generally been the explanation that is given to me. Here's one, Michelle. It says, why do you not hear about crypto outbreaks at untreated water venues, i.e. lakes?
We do hear about those outbreaks, but not as much. I think part of it depends on, for example, if it's a river. If it's a river, the water kind of remediates itself. It replaces itself, so any contamination is lost as the river flows at one particular beach, I would say. The other thing I would also say is our natural waters tend to attract bathers from a wider geographic range. People are willing to drive further to go to a lake or an ocean than they are to a pool. We have so many pools. So it's oftentimes a lot of these outbreaks are occurring in people who live basically in one health department's jurisdiction. So it's much easier to pick up versus maybe an outbreak associated with a lake or an ocean involves many health departments, and it's hard to make the connection among different health departments.
And this is Doug Sackett, just weighing in a little bit too. I think you hinted at that, Michelle. It's just a plain dilution factor of, an event in a natural body of water. You get, whether it's flowing or just plain dispersion and dilution, probably mitigates the risk quite a bit on that. Of course, it's all going to be based on the individual body of water. If you have a confined low water mixing and moving and an exposure in a shallow water area in that situation may be more at risk, but just probably general dilution has a big impact.
Okay, Michelle, this is an earlier one. Okay, it was about, is there anything, okay, give me a second, it's pool deck, I found it. Okay, what products would eliminate crypto on the deck if an accident leaks out?
CDC does have recommendations for cleaning up body fluid spills on the pool deck. They're a bit different. And part of it is because crypto hates to be dried or hates desiccation. So it's different than trying to remediate the water. So just by cleaning it up, you're doing a several log cleaning or exchange or an activation of Cryptosporidium, and then any exposure to the sun. A dry surface for 4 hours would inactivate Cryptosporidium as well.
Thank you, and you answered two questions at once there about sunlight. Okay, we have a question from Maurice Redman here in the great state of Georgia. Does the MAC give credit for regenerative filter use to reduce crypto? Michelle, either Michelle or Doug?
This is Doug. Right now, it does not, but I have to, there's a question earlier too about log credits in the MAC, and there is a change request proposal that deals with filtration and log reduction concepts. It's under review by the Technical Review Committee, and it'll be evaluated and voted on by membership. But it's something we continue to explore and look in advanced technology and how we, from a regulatory standpoint, how to deal with this. So I would suspect that in the future, as we change requests and more data, that filtration and other methods of treatment will come into play and recognize it for crypto reduction. But right now it does not.
Thank you, Doug. A question from Sarah Snyder. Are there any recommendations for splash pads for cleaning after a fecal incident? And once again, fecal incident, I'm anticipating. Sarah, please confirm if this is a formed fecal incident or a diarrheal or both.
And Jason, this is Michelle, just to chime in a little bit. With the diarrheal incidents and smaller aquatic venues like hot tubs and spas, if there is a diarrheal incident in these smaller venues, an option 2 hyperchlorination would be draining and cleaning. I mean, as Laura pointed out in her talk, it costs money to hire somebody to hyperchlorinate, for 13 hours plus. There's that time to bring the chlorine up, the chlorine down. So it might just be easier for a smaller aquatic venue to drain and clean.
Okay, we have a question from Harvey Klein here. And Laura or Michelle, please feel free. Any info on Giardia and cyanuric acid, kind of getting to what I was speaking to earlier about the other pathogens.
This is Michelle. I'm not aware of any studies looking at Giardia and cyanuric acid, but there are studies from decades ago looking at bacteria and cyanuric acid, and we see a delay there. Given that we see a delay with inactivation of Cryptosporidium in the presence of CYA, there's no reason to think we wouldn't see one with Giardia. Probably not to the extent that we see with crypto, but probably greater to the extent than we see with bacteria.
Yeah, I second that. I've never come across a publication that talks about the effects cyanuric acid has on inactivation of Giardia.
Okay, and we're coming up on the hour here. Appreciate all the attendance, and Nacho, probably best to close the webinar.
Yeah, I just wanted to take another moment to thank all of our speakers today and thank all of you for joining in and being so active in our chat box. I think it was really helpful for everyone to see where you're from, and of course, thank you for all of your questions and comments. Feel free to follow up on Nacho's website for, again, the webinar recorded and the slides. So with that, thank you all and have a great Memorial Day weekend.
The chairperson has disconnected.